It's just like being inside a life-sized video game.
I am standing in our virtual reality rehab environment. It's called the Karen system.
Amy Chan is a neurological physical therapist at the Cleveland Clinic.
Oh, good. Go right to 20%.
This is actually a tool that we actually get to use on a daily basis to challenge people with Parkinson's disease. We can get a patient up here to work on walking, balance, multitasking, and we can keep them very safe using the harness. They can be walking in a park that has to go up and down hill and work on using their hands. They can work on cognitive function while they are walking.
Parkinson's patients typically start with traditional physical therapy, practicing how to move well.
So I usually describe it to them as, are you ready to up your game? Work harder so you can change your brain.
You heard right. This type of exercise can actually change your brain.
The exercise had to be intense, but not dangerous. Patient will stay on this for anywhere between half an hour to 45 minutes.
Good job, Sam.
A gaming type of environment can provide that type of motivation, empower them, motivate them to work harder, but without sacrificing those quality movement that we work on in the baseline. We know that someone without Parkinson's disease, if you do regular aerobic exercise, it decreases your risk of getting Parkinson's. You also have a lot of benefit decreasing other disease like heart disease, high blood pressure. Beside the physiological benefit, we know that if you do regular aerobic exercise, it can improve your cognitive function, your thinking process, your executive function. It helps you decrease stress and depression. Some of these symptoms for someone with Parkinson, these non-motor symptoms like anxiety, depression, not sleeping well, can be more problematic and affect their quality of life more than those motor symptoms that you see like walking problem or tremor. And those non-motor problems like sleeping and depression doesn't respond as well to medication like the motor problem. So more power to using exercise as an important tool to manage Parkinson's. The earlier you start, the more brain cells you have to protect.
This type of therapy is also being used to treat patients with multiple sclerosis and other neurologic conditions. For Fox 8, I'm Dr. Marc.